Understanding strokes, a breakdown. A stroke occurs when the blood supply to a part of the brain is disrupted. This disruption prevents brain tissue from receiving essential oxygen and nutrients, leading to cell damage. There are two main types of strokes, ischemic and hemorrhagic. Ischemic strokes are the most common type, accounting for about 85% of all cases. They occur when a blood clot blocks an artery supplying blood to the brain. These clots can form due to a buildup of fatty deposits known as plaque in the arteries. Hemorrhagic strokes, while less common, are just as serious. They happen when a blood vessel in the brain ruptures or leaks, causing bleeding in the brain. This bleeding compresses surrounding brain tissue, leading to damage. High blood pressure is a significant risk factor for hemorrhagic strokes. It's crucial to remember that both types of strokes are medical emergencies requiring immediate attention. Early recognition and treatment are vital for improving outcomes and reducing the risk of long-term disabilities. Recognizing the symptoms of a stroke is critical for timely intervention. These symptoms often appear suddenly and may vary depending on the area of the brain affected. One of the most common signs is sudden weakness or numbness in the face, arm or leg, typically on one side of the body. This weakness can make it difficult to raise one arm, smile evenly or speak clearly. Vision problems are another red flag. A person experiencing a stroke may have sudden blurred or double vision or even complete loss of vision in one or both eyes. Dizziness, loss of balance, or difficulty walking are also common symptoms. A sudden severe headache, often described as the worst headache of my life, can be a sign of a hemorrhagic stroke. Other symptoms include confusion, difficulty understanding speech, or trouble speaking. Understanding the causes and risk factors associated with stroke is crucial for prevention. While some risk factors are beyond our control, others can be modified through lifestyle changes and medical management. High blood pressure is a major risk factor for both ischemic and hemorrhagic strokes. It damages blood vessels, making them more susceptible to blockage or rupture. Smoking also damages blood vessels and increases the risk of blood clot formation. Other modifiable risk factors include high cholesterol, diabetes, obesity, and lack of physical activity. These conditions contribute to the development of atherosclerosis, a condition where plaque builds up inside the arteries, increasing the risk of stroke. Non-modifiable risk factors include age, genetics, and ethnicity. The risk of stroke increases with age, and family history plays a role. Certain ethnicities, such as African Americans, have a higher risk of stroke due to a higher prevalence of risk factors like high blood pressure and diabetes. Time is of the essence when it comes to stroke. The faster a person receives medical attention, the better their chances of survival and recovery. Remember the acronym FAST, which stands for face drooping, arm weakness, speech difficulty, time to call emergency services. If you notice any of these signs in yourself or someone else, even if they are temporary, call 000 immediately. Don't wait to see if the symptoms improve. Immediate medical attention is crucial for minimizing brain damage. Treatment for stroke depends on the type and severity. For ischemic strokes, clot-busting medications like TPA can be administered to dissolve the clot and restore blood flow to the brain. This treatment is most effective when given within a few hours of symptom onset. Hemorrhagic strokes often require surgery to stop the bleeding and relieve pressure on the brain. Post-stroke care may include medications to prevent future strokes, rehabilitation therapies to regain lost function, and lifestyle modifications to manage risk factors. While stroke is a leading cause of death and disability worldwide, understanding the risks, recognizing the symptoms, and seeking immediate medical attention can significantly improve outcomes. By taking proactive steps to manage modifiable risk factors, we can reduce our risk of stroke and protect our brain health.